Now imagine you are in a hospital room. The heart monitor is working, the chest is moving. But the doctor says brain death has occurred. What do you mean? If the heart is beating, how can a person be considered dead? Today, we will discuss the most mysterious secret of the brain. What is brain death? What is clinical death?
How did our ancestors understand death? And the strangest question, does the brain actually want to die?
Brain death is the irreversible loss of all functions of the brain and brainstem. What does this mean? No consciousness, no reflexes, no breathing command, no electrical activity in the brain. The heart may beat for a while longer because the heart is a muscle with its own rhythm, but the brain's life command center is completely shut down. Scientifically, this condition is considered medically irreversible death. In other words, it is not a coma, it is not a vegetative state. The body may still be warm, but the system software has shut down. In clinical death, the heart stops, breathing ceases, but cells do not die immediately. If CPR is performed and oxygen is provided within the first few minutes, the brain can start working again. So, clinical death can sometimes be reversible. In short, to understand the difference between the two, if we think of our brain as a computer, clinical death means the computer is off but still has a battery. Brain death means the motherboard is completely burned out and cannot be restored. So how did our ancestors understand death? There were no modern devices, no EEG, no monitor. So what were people looking at? The breath mirror test, pulse sensation, pupil response, skin color? But the problem was that in the past, people were sometimes buried prematurely because it was very difficult to distinguish between deep coma and actual death. In the Middle Ages, bells were even attached to some coffins in case the person was not actually dead. Today, doctors make decisions by looking at brainstem reflexes, breathing tests, electroencephalograms, and imaging. So now, death is not the silence of the heart, but of the brain. Scientifically, the brain is not an organ that wants to die. On the contrary, the main function of the brain is to survive. For this, it produces fear, gives a feeling of hunger, activates the fight or flight system. In other words, it is an algorithm that defends life, not brain death. So why do people feel like they want to die? Because stress hormones increase, dopamine decreases, the prefrontal cortex slows down, the brain does not want to die. It only wants to avoid pain.
Now we come to the solutions part. When the mind darkens and you find yourself thinking it would be better if I died, ask yourself this question. If the current me were the 5-year-old me, what would I do? Probably, even when this angry, I would find something to play with and laugh about, because childhood memory reduces the brain's threat system. It affects the increase of serotonin. Sometimes engaging in childish behaviors to relax your brain is the perfect solution. One day, the heart may stop, but what truly keeps a person alive is not the heartbeat, but the meaning the brain creates.